the authors of the document in order they can be clear, and they may well decide on a slightly different path, or they will nuance what has been suggested. Being in medicine is always about a commitment to trying to help other people, whether in my previous role as helping an individual, and now in this role as helping large numbers of people. And everybody that's in healthcare has this sense of duty and purpose in order to improve other people's lives. So that's very much what brings me back to work every day, in order that I can continue to try to do my best to help as many people as I can and to save lives wherever possible. I think probably my most inspiring moments have been the thanks from the members of the public. Just as I mentioned that I like to help people, that's why I've come into this role. It's very much having some feedback, and there's no more important feedback than coming from a stranger you've never met, coming up to you and saying, "Dr. Lee, you don't know me, but thank you very much for what you've done." Those instances have meant more to me than you'll think. I probably look like I've given a fairly bland response to you, but I've really taken those messages in. And it's not necessarily from people who are, coming up and talking to me in the supermarket or in the bank or something. It's also people driving down in their builders' trucks, giving me a toot on the horns and waving their arms out in the air and saying, "Well done, Dr. Lee." I mean, all of these things have really made my life very rewarding, and I thank you for those.
The COVID-19 pandemic is affecting everything from forest cover and marine pollution to the behavior of wildlife, but most of all, of people. Me, you. After Hurricane Ivan, Caymanians discovered we are vulnerable to calamities we thought only happened elsewhere. We were reminded then, as we are being reminded now, that we are resilient. We are powerful. We are community-minded, Caymankind. For the people of the Cayman Islands, moments of crisis also present opportunity. We are the narrators. You are the catalyst for change. We, you, are responsible. This is not just our pandemic story, but it is the story of how 3 tiny islands came together to change course in uncharted waters toward greater national solidarity, functionality, and pride.
steps you can take to help prevent the spread of coronavirus. Stay calm. Think carefully about how you can help your community and loved ones. Practice self-care. Focus on your mental health. Wash your hands. Use soap and water for at least 20 seconds and wash often. If you can't use soap and water, hand sanitizer is a good alternative. Hand sanitizer should have more than 60% alcohol content. Cover your nose and mouth in a tissue when you cough or sneeze. Make sure to throw your tissue away in a lined trash can. Wash your hands after you've coughed or sneezed. If a tissue is not available, cough or sneeze into your elbow and not your hands. Practice social distancing. Stay at least 6 feet away from other people. Avoid crowds. Plan activities outdoors as much as possible. Wear a mask. Make sure it covers both your mouth and your nose. Wash your hands if you've touched the front of your mask. Don't ignore your symptoms. Common symptoms of COVID-19 are fever, cough, shortness of breath, fatigue, and loss of taste or smell. If it is an emergency, like you're having trouble breathing, call 911. Do not go to work, use public transport, or be in public areas. If you believe you've been exposed to COVID-19 or have a fever, cough, or shortness of breath, call your healthcare provider or the flu hotline at 1-800-534-8600 immediately. We want everyone to stay as healthy as possible. Let's keep working together to prevent the spread of coronavirus.
COVID-19 can be spread by people who have contracted the virus, even if they have mild or no symptoms. Taking an easy-to-use lateral flow test will help to quickly identify people who are infected with COVID-19 who might otherwise go undetected. If you are experiencing COVID-19 symptoms, do not use a lateral flow test. Stay at home, contact the flu hotline, and consider scheduling a PCR test by visiting hsa.ky. Step 1. Before taking the swab, be sure to wash your hands with soap and water or use hand sanitizer. Lay out all the items in the test kit onto a clean surface. Step 2. Read the instructions provided in the test kit. Step 3. Place the tube in the tube holder located on the box. Step 4. When you're ready, place the fabric tip of the swab inside your nostril, about 2.5 centimeters or 1 inch up, and circulate 5 times. Use the same swab and repeat the process in the second nostril. Step 5. To complete the test, put the fabric tip of the swab into the tube so it's in the fluid. When processing, the swab must be rotated in the tube for 30 seconds, then rotated 5 times while squeezing the side of the tube. Place the swab into the plastic waste bag. Gently squeeze the tube to place 4 drops of liquid onto the test strip. Step 6. Set a timer and wait 15 minutes to read your results. Step 7. Safely discard test kit and contents. Now it's time to read your result. If your test result is negative, you may continue your daily activities and continue to practice good hygiene. If your test result is positive, you must stay home, contact public health to report your result. You can use the online positive test result reporting form at www.exploregov.ky/report-covid19-result. Your parent should inform your school of the result, and you'll undertake remote learning.
everyone. Today I'm going to demonstrate how to use the lateral flow tests or antigen detecting rapid diagnostic kits. First of all, you need to cleanse your hands or wash your hands as you always need to do with this sort of maneuver. This is a single-use kit, and I'll take all the parts of it out. You'll see we have a swab, a cassette, a waste disposal bag, the fluid in a little tube, and the instructions. It's very important that you should read the instructions in order to conduct the test. The test is designed to be used by people. In the instructions it says 18 and above, but our advice is that people 12 and above can use this. Under 12, you should perform it either by an adult or with the assistance of an adult. First thing of all is I need to make a little hole in the top of the cardboard, which I'm going to do with a key. There's a pre-printed hole that's there, and I can then take out the tube with the fluid in it and the little nozzle that goes on the end and take off the lid of the tube. And that little hole is somewhere to rest the tube so it doesn't fall over and drop everything on the floor. Next is to take the swab and make sure that you take the swab from the end which doesn't have the tip that's going to go into your nose. Take the swab out and then circulate the swab in your nose 1 inch or 2.5 centimeters from the edge, 5 times in one side. I'm circulating it 5 times and then 5 times in the other. We're then going to take the tube up and twirl the swab about in the tube for 30 seconds. After the 30 seconds, we squeeze the tube and rotate the stick another 5 times to give some pressure to make sure that everything on the swab comes off into the liquid. Finally, we remove the swab and dispose of it carefully and pop the dropper back onto the tube. I'm going to open the test cassette now. Inside there's the test cassette and a little packet of silica gel to keep everything dry. And you can see this is what the test cassette looks like. At the bottom, there's somewhere for the sample, and then the result comes at the top. The next stage is for us to put a few drops of the liquid onto the hole marked S for specimen, and I'm going to put 4 drops onto here. And then dispose of this safely into the plastic bag that's marked biohazard. And that's also where I'm going to put the swab and eventually the cassette when it's ready. And then dispose of that double bagged in your bin. We now have to wait for 15 minutes whilst this develops, and then the cassette needs to be read between 15 and 20 minutes to see whether there is a positive result, a negative result, or one that's equivocal, meaning that the test didn't complete correctly. We can now see that I have a stripe where the C is marked. That's for the control strip, but nothing under the letter T. So that means that I'm negative for today.
The program board is made up of a cross-section of the public service. We have a number of chief officers, we have a number of CEOs of our statutory authorities, we have some of the deputies in the statutory authorities. And we came together to deliver a project, and that was to reopen the country safely to tourism. That has been our overwhelming priority, to reopen safely and to put us in a position where we don't have to shut down again. So that has been the major focus of the program board. And we have had to co-opt people from time to time. So there was a time when we were dealing with just evacuation flights. But when we then moved to welcoming tourists, we had to bring in our colleagues from the tourism department, our colleagues from Airports Authority, our colleagues from civil aviation, and of course engage with the private sector, because they are our key partners in this. So we have been really focusing on engagement, but also focusing on giving the government the very best advice possible about how we reopen our country safely. So that is the responsibility and the main purpose of our program board. The government has said to us, please don't tell us that we are ready to reopen. We would like you to prove to us that you're reopening. We want to see that you have drilled down in the various key topics and key areas to make sure that we are ready for whatever happens. So, for example, on our public health side, are we ready? Is our hospital systems ready? What is our bed capacity? What happens if our hospital becomes overwhelmed? What happens if we have large numbers of persons who are sick, don't necessarily require critical care, but they need oxygen? So what are we doing to make sure that we have the necessary oxygen supply? It's all of those things that we have been looking at. That then goes to, on the other spectrum, to tourism. Well, what happens if a tourist gets sick? What happens if a tourist needs to be flown out? What provisions are we putting in place to ensure that the Caymanian people is not burdened with hospital bills of our tourists? What procedures have we put in place to ensure that our hotels are ready in terms of the sanitation protocols? Our taxis are ready with sanitation protocols. What happens if we have a tourist arrive and is sick at the airport? All of those things we have had to really think through and make sure that we have policies and procedures in place to deal with those very real issues that could arise once we reopen.
Good afternoon, everyone, and welcome to today's COVID-19 press briefing. I'm Shanda Gallego. Thanks for joining us. We begin first with prayer from Pastor Mitchell Ebanks Eckstein.
Lord, I lift up all our leadership. Good morning. This is Pastor Mitchell Eckstein of the Ministry of Peace Church. Greetings in the name of our Lord Jesus Christ. Let us pray. Almighty God and Heavenly Father, we bless you and we praise you this morning in the name of Jesus. I lift up, Lord, our government leaders. Lord, I lift up all our leadership, Father God, to bring them before the throne of grace, that they may receive wisdom from above as they govern this nation, Father God, as they make policies, as they go about, Lord, carrying out their business, Father God. I pray for the renewal of their hearts and their minds, Father God, that they will realize they need this help from above, that life and the challenges of life are much too great for them from a human level. I lift up all our frontline workers on the entirety of this island nation, Father God, for protection, Lord, and for wisdom and for directions. I pray for the softening of our hearts, that we may turn to you, Father God, for your love and for your salvation for now and for the life to come. Lord, I come against this COVID virus, Father God, in the name of Jesus, to destroy it, to defeat it, Lord, to undo it in this nation and across this world. Father God, I thank you now that you have made this all possible, the access to your almighty power and love through and in the person of Jesus Christ. Lord, we give you all praise and glory and thanks in the name of Jesus Christ, Yeshua. Amen and amen. Good morning. This is Pastor.
Thank you to Pastor Mitchell Ebanks Eckstein for providing us this moment of prayer. Joining us today in studio is Premier, the Honorable Wayne Panton, Tourism Minister, Honorable Kenneth Bryan, Health Minister, Honorable Sabrina Turner. We are practicing social distancing in the studio, so we will only see 3 people on the panel at any one time. Also in the studio, a number of senior government officials, journalists, who are also joining in on Zoom. We would also like to acknowledge our sign language interpreter, Caroline Powell. Welcome to you guys. We now turn to our Chief Medical Officer, Dr. John Lee, for the latest COVID-19 report.
Good afternoon, everyone. It's quite a packed lot of information I need to try and share with you today. We, across all of the 3 hospitals in the islands, it's been identified that around 55 beds are available to look after COVID patients while still maintaining elective services. And we're keeping a very close eye on how many of those 55 are being utilized at any one point and have been doing so for some weeks now. At the moment, of those 55 that have been reserved for patients with COVID, 36% of them are in use. There are 16 being used at the HSA and 4 at Health City. For the patients at the Health Services Authority, 7 are on supplementary oxygen and as 1 is requiring the support of a ventilator machine. And at Health City, 1 is requiring supplementary oxygen. These figures have been relatively steady as far as the admissions are concerned for some time now. I would think they've been steady for around 10 days to 2 weeks. But don't think that they're static. They're changing all the time. So, for example, over the 24 hours until this morning, at the Health Service Authority, 3 people were admitted, as well as 3 people being discharged. And since the start of this crisis, community outbreak, I'm sure we all feel it's a crisis. We have admitted over 50 people to the hospitals, but equally we've discharged over 40. And so the numbers are constantly moving. And that thanks very much to all of the very dedicated healthcare workers who are looking after these people so well, making them feel better and getting them home again. For the test results, we have 205 additional community people who are positive, which includes 57 people who reported on lateral flow tests and 1 traveler who was in quarantine. This figure, this relatively high figure again, is steady, and I'm pleased that that's steady. Obviously, we hope that it will begin to drop off in a few weeks' time, but it remains steady. And if it's steady, we are currently managing it well. Our prevalence of COVID disease, which means the number of people who are actively, who we count as positive in the community, is currently at 5%. That number is 3,673 people. And of them, 1,472 were identified on lateral flow tests, to show you how well these are being deployed across the islands. Since the 9th of September, when we had reported 726 positive people for SARS-CoV-2, we now have 5,362 people. So 4,430 additional since that date, quite a considerable number. And of these, 106 have been positive on the sister islands. As far as vaccinations are concerned for today, 55,558 people have had their first dose. That represents 81% of our estimated population of 71,106. 78% have had their second dose. For those 2 figures, for those people over 12 who are all eligible for the vaccination, we have reached 93% having had the first dose and 89% having had the second dose. So great figures for those who are eligible. And 8,170 people have had boosters or third doses, which represents 11% of our total population. I don't have any news to give you on the vaccinations for the 5 to 12s. We are eagerly awaiting information from the MHRA in the United Kingdom in that regard, but I have not heard anything to pass on to you today. I know a lot of people have been asking about death certification in COVID, and death certification is really a pretty standard matter. The World Health Organization sets out what a standard death certificate should look like. And at the top of the form, you have a number of lines where you would list all of the things that immediately contributed to somebody's death. Very unfortunately, it was very sad that we had to report 2 deaths around the weekend, but both of those 2 people had COVID as a contributory factor to their deaths. There's also another section which says secondary matters. And you can imagine that I'm going to give you a scenario which no one would ever want to happen, but it does happen from time to time. If somebody, for example, had a car accident and then they ruptured the big internal vessel called the aorta in their body, and that caused an exsanguination, and then their heart failed as a result. Those issues would, but also they were COVID positive. That would not, for example, be listed as a COVID death because it was very clear that the COVID positive status of that person was not at all related to the COVID death. But in many other cases, it will be a COVID death, as COVID would have contributed in some way, whether large or small. And for many of these very sick people may have been the thing that tipped over and caused them to have passed. Good news that today the Ronapreve, that's the drug that we famously treated, it was one of the cocktail of drugs that treated Donald Trump, must be maybe about 9 or 10 months ago, should be arriving on the islands this afternoon. It's been tracked and it should be arriving. It's a combination of 2 monoclonal antibodies, one casirivimab and one imdevimab. And these 2 monoclonal antibodies latch on 2 parts of the virus and stop it penetrating the cells, particularly around the respiratory area, and can be used in the acute treatment of somebody who is sick with COVID. It's known to reduce hospitalizations and deaths, needs to be used early on treatment. It's particularly good at people who may be immunocompromised for some reason, either because they have multiple medical problems or some other reason for them to have a depressed immune system. So it's very good news that that specific treatment is arriving today in the Cayman Islands. Last thing I wanted to say, just with the cooler weather, we're all going to start to enjoy it. We're all going to be able to get out and about without feeling quite so hot. So do keep as fit and active as you can, because we know that keeping fit and active will help your cardiorespiratory system and help you to stave off any illnesses with movement. And movement is absolutely the key to a healthy life. Thank you.
That is our Chief Medical Officer, Dr. John Lee. Thank you for that update. We now turn to the Honorable Premier, Wayne Panton, for his update.
Good afternoon, and thank you for joining us today. As we share important updates on our move to phase 4 of our reopening plan this coming Saturday, the 20th of November. So despite the myriad of pandemic-related challenges that Cayman and indeed the rest of the world are currently facing, I want to reassure you, I want to reassure the country that we are ready. The coming weeks will be pivotal for us in the Cayman Islands. We are embarking on a journey to reopen our economy and our borders to visitors after almost 2 years of significant closures. All of this while we continue to manage unprecedented levels of community transmission of COVID-19 and work to protect our healthcare and education systems so that our economy can remain open. For many, this move to phase 4 has been eagerly awaited and anticipated. However, I am very much aware that there are others who, for whom there is anxiety in relation to this in our community. And some are not convinced that this is the right time or the right way to make this transition. Phase 4 of our reopening plan moves us forward cautiously. And I am confident that we are doing so without losing sight of our commitment to this country, to do so in a responsible and informed way. There is no easy way around this, ladies and gentlemen. One only has to look at the resurgence of COVID-19 in the UK, Ireland, Germany, Austria, and even our sister overseas territory, Gibraltar, which boasts one of the world's highest vaccination rates. They're all experiencing a new wave of COVID-19 infections. And as a result, are reintroducing regulatory measures, including restrictions on restaurants and bars and social activities. So if the government waited for the right moment for Cayman to emerge from our cocoon into a world which was in which COVID no longer exists, we may never again welcome tourists back to our shores. Today, I want to start off by sharing with you 3 key reasons that give me hope and confidence in our future. Firstly, we have a team of elected members of parliament and public servants who are both capable and committed. Their number one priority has been keeping our community safe as we prepare for phase 4. The PAC government has certainly had to make some very difficult decisions, starting with increasing the target population figure. Our push to vaccinate 80% of a higher population means that thousands more Caymanians and residents have been protected. Despite many saying that it was impossible, we have achieved and exceeded our goal thanks to the almost 58,000 people, representing 81% of our population, who went out and got vaccinated. These were tough calls. We delayed the phase 4 move to ensure that more robust contingency plans were in place. We pushed for booster shots, and with the continued support of the governor's office, we have them going into people's arms. We have introduced lateral flow tests, which allow schools to safely continue classroom learning and reduces isolation hardships. I can also confirm that we have made an agreement with the Family Life Centre to reassemble the field hospital as a key part of our contingency plans. We've also designed, built, and successfully launched the travel portal to ease the experience of travelers seeking to come to Cayman. The critical preparedness plans that the Deputy Governor and I have spoken on recently have been in motion behind the scenes, and these include testing them against many what-if scenarios. That testing included a stress test of all of our hospitals, led by our Chief Medical Officer, Dr. Lee, last week. And I can take comfort in knowing that there are solid solutions in place to address these various scenarios that may occur if that happens. Getting to this point has been a collective effort by the members of the government, as well as the many highly qualified public servants and civil servants, medical professionals, and specialists whose contributions have been invaluable, and to whom we owe an ongoing debt of gratitude. We have also worked alongside private sector partners, to whom I want to also express our sincere thanks as well, to ensure that our plans are realistic from an operational level and sustainable throughout the reopening. Based on all of this, I remain confident that we can continue to make the best decisions for our people, even if they are at times unpopular. And more importantly, I am confident that we are ready, and as ready as we can be, to move to phase 4. Secondly, as we move to secure the economic welfare of our people, I want to be clear there will be no trade-off on the well-being of our people. We need both, and our way forward strikes the right balance. This government will always put people first. However, we also have a duty of care to businesses, business owners and their employees, and especially those who have endured so much and borne the brunt of the impact of the closure of our borders. Their suffering has been very real too. They have experienced the anguish of not being able to provide for their families, and many have been forced to rely on a government lifeline to make ends meet. We've also faced the stark reality that we cannot sustain the significant financial support our government provides and continues to provide to those in our community who need it as a result of the borders remaining closed. But again, our priority remains balancing our economic welfare and the well-being of our people. That is why we are deeply concerned by the current spike in community transmission, which has resulted, sadly, in 2 deaths and increased hospitalizations. Although, as Dr. Lee has noted, they have been relatively stable. I am especially worried that on average between 70 to 85% of those requiring hospitalization are unvaccinated. But thankfully, our healthcare system has been standing firm. We have some of the best clinicians and facilities in the world, and those in need of care are able to receive it. Our hospitals have demonstrated that their planning and preparations were spot on, and despite the obvious strain, they continue to deliver. And we are right now making plans to get additional support and relief for our healthcare workers at the hospitals who have been serving tirelessly. However, I think it's important to point out that the asymptomatic and mildly symptomatic far outnumber those who require care. And this is further evidence that our focus on achieving a high vaccination rate is working to shield our healthcare system and our community. So again, given the strength of our healthcare system and the success of our vaccination program, I am confident we can strike the right balance between the long-term economic welfare and the well-being of our people. The third reason why I'm hopeful for our future is my faith in the resilience and strength of our Caymanian people. For almost 2 years, we have reaped the benefits of complying with the public health advice, following the regulations and guidance in order to keep ourselves and our community safe. Therefore, as I make this appeal to the entire community of the Cayman Islands, I believe that my words will fall on fertile soil. Reopening and learning to live with COVID-19 in our community is a shared responsibility. Government absolutely has our part to play, but each individual, every single one of us, has to take a long, hard look in the mirror. Returning to what we call a normal life or a new normal requires a daily commitment to practicing safety measures and adjusting our activities. Now, we all know Caymanians are very caring and affectionate people, and I'm certainly one of those. No one enjoys a good warm hug more than I do, but we cannot risk that now. The book of Ecclesiastes, chapter 3, verse 5 reminds us, there is a time to embrace and a time to refrain from embracing. Right now is the time to refrain. And displays of affection for those who are not living, refrain from embracing, and displays of affection for those who are not living in our own household. We also need to refrain from parties and fetes and walking around crowded bar rooms without masks on. We also need to ensure we are doing regular lateral flow tests, especially before we go to visit our elderly and vulnerable members of our community. These are some of the high-risk behaviors that we absolutely have to curtail for now. If we do not take responsibility for ourselves, if we do not act to slow the rate of transmission, the government may be left with no alternative than to implement additional control measures. I am, however, confident that if we as a community work together, we can avoid having to do so. We know what to do. We've done it before. And if we all buckle down, we can absolutely do it again. So in summary, on Saturday, 20th November, 2021, we will reopen our tourism industry with confidence, knowing that the critical preparedness and response plans are in place to address any of the scenarios that come along with reopening. Please be responsible citizens and residents of this country by adhering to the safety measures in place. This includes reporting positive lateral flow test results and isolating as directed to minimize further spread and to protect each other. And finally, we are resilient. We've always stuck together through the hardest of times. We're a strong, responsible, informed people, capable of making the best decisions for the greater good of our community. There is no way around COVID-19, ladies and gentlemen. In fact, it was never possible to avoid it. We have delayed the inevitable for as long as we could. Right now, we are facing some strong headwinds and some choppy seas, but the Cayman Islands and the good ship Cayman is well built and seaworthy. I maintain faith that the good Lord will continue to bless and protect us and grant us wisdom as we navigate through this difficult time. I want to confirm that the Cabinet has considered two sets of regulations recently. The Control of COVID-19 Travel Regulations 2021 and the Control and Management of COVID-19 number 2 Regulations 2021. The Honorable Minister of Tourism will provide details and highlights in respect of the control of COVID-19 travel regulations, because that set is specific to the changes needed to facilitate phase 4. I will offer some brief highlights of what we seek to achieve in the control and management of COVID-19 number 2 regulations. These regulations consolidate the prevention, control, and suppression of COVID-19 travel and boating regulations and the control and management of COVID-19 amendment regulations that previously existed. In respect of the changes, public gatherings for now remain at 100 persons for indoors areas and 250 persons for outdoors. However, we have made some allowances. If the venue can host an event splitting the numbers of persons indoors and outdoors, then the event is allowed 100 persons indoors and 250 persons outdoors with the same venue. If it is an event at an outdoor venue that can be divided into 2 or more partitioned areas, activities can simultaneously be held in each of those partitioned areas, not exceeding 250 persons in each area. These provisions do not include the staff of the venue in the number of persons allowed. We understand that we are moving towards the festive season, and there is a need to support businesses as they welcome larger gatherings. With that balance in mind, one exemption which we will allow is in respect of premises which can exceed the gathering limits by the owner or operator arranging for approved testing of patrons with lateral flow tests. These would need to be completed by a registered practitioner that verifies a negative result for all patrons and employees no more than 24 hours before the gathering. The updates to public gatherings do not apply to the following businesses or office premises, educational institutions, emergency shelters, and churches. Churches and businesses should remember that at any time, congregants and customers who are not of the same household should remain or maintain separation of at least 6 feet. Face mask rules remain unchanged. The boating rules remain unchanged. and the process and who can travel to the sister islands remains unchanged. We will be reintroducing the ticketing offenses for violations of these regulations. We realize that the threshold for many of the offenses was simply too high, requiring prosecution. However, compliance with these regulations are essential to protecting our healthcare system and our economy. There are a total of 27 ticketable offenses, ranging in fines from $250 up to $1,000. I strongly suggest that everyone carefully take note of the regulations. They can do that on explore.gov.ky, as these regulations will be enforced by the Royal Cayman Islands Police Service. Our Phase 4 our Phase 4 control and management of COVID-19 regulations support the private sector and the business community, who have a large role to play in helping us transition into a successful reopening. The regulations are aimed at ensuring that businesses can operate safely and our people remain safe. However, we in government have been receiving too many reports, too often, that businesses in the community operate on the outskirts of what is acceptable regarding public health and safety protocols. And we must have this addressed. The regulations for restaurants and bars call for tables to be 6 feet apart, and masks must be worn by all front of house staff. Imagine having to close your business down and pay fines because you shrugged off enforcing the policies and guidelines that have been put in place to protect your customers and the community at large. In closing, it is our hope to be able to share in January 2022 an update on moving to Phase 5. As we know, there is much concern that we do not have a firm date for no quarantine travel with unvaccinated children. We will get there. Thank you again for your attention.
Thank you, Honorable Premier. We now turn our attention to Tourism Minister, Honorable Kenneth Bryan, for his COVID-19 update.
Thank you, Chanda. And before I get started, I'd just say, Premier, don't worry, we'll both get a lateral flow test together. And when we come back with a negative, I'll give you a big hug, okay?
Mine was done this morning, sir.
That being said, a very pleasant good afternoon to the viewing public and those who have tuned in here in the studio, as well as those online. With just 2 days away from moving into Phase 4 of the government's reopening plan, and I think those who are a bit fearful, there's a lot of people who are also excited. I know the public have been looking forward to hearing more about the details of the plan, so today I'll be providing updates on sanitation guidelines for the tourism sector, the new lateral flow policy in respect to travel for tourism purposes, the travel arrivals process, and other details that are specific to Phase 4. Starting first with the updates on sanitation guidelines. In preparation for reopening, the Department of Tourism has collaborated with the Ministry of Health, the Department of Environmental Health, and private sector stakeholders to develop an updated sanitation guidelines for the tourism sector. The guidelines are available for various industry sectors, including accommodations such as hotels, guest houses, and apartments, as well as attractions, car rentals, restaurants and bars, retail, public transport, tour operators, fishing, snorkeling, and scuba diving. As the 20th of November, taxi operators will no longer be required to complete the government-supported decontamination process. Instead, taxi operators will follow the new sanitation guidelines for the tourism sector. The updated sanitation guidelines for the tourism sector are published on the DOT website, which is www.ourcayman.ky, and are intended to be a working document for businesses to enhance and customize their specific operations. Now turning to the lateral flow testing policy. Lateral flow testing will continue to be an important part of our overall safety protocols as we move forward into phase 4 of our reopening plan and beyond. A lateral flow testing policy for the tourism sector has been finalized by my ministry and is supported by the program board. In the plan, we are strongly recommending that all tourism-related businesses implement twice-weekly testing programs for their employees and stakeholders. The policy stipulates that travelers, which includes tourists, returning residents, and Caymanians, are required to take a lateral flow test on day 2, 5, and 10, where arrival day is day 0. So when you arrive in the Cayman Islands, your first day doesn't start till the next day. All travelers must be tested and results certified by a testing provider. I'm very happy to share that we are working to expand the testing capacity to doctors' offices, including locations such as Health City Cayman, Doctors Hospital, 7 Mile Beach Medical Clinic, and over 25 other healthcare providers. The full list will be publicized on the Department of Tourism and the government's explore.ky website to ensure certified LFT testing services are readily available to all travelers across the 3 islands. The cost of the lateral flow test will be $25 CI, and the cost will be borne by the traveler. I would like to emphasize that the LFT policy applies to all travelers, including visitors and residents alike. If a traveler tests positive while on island, they're required to isolate. Therefore, travel insurance is a requirement in phase 4 of the reopening plan and is required to help travelers meet the cost of medical, accommodation, and travel costs due to an extended stay as a result of isolation. I would like to note that the LFT policy is included within the control of COVID-19 travel regulations, which provides for a fine and a summary conviction, of $10,000 and imprisonment for a term of up to 2 years. Wow, better do the test. Or both for persons who don't comply with the testing regulations. I didn't realize it was that much, but I'll be doing my test, I promise. I would like to turn our attention now to highlight some of the primary differences in phase 4. There are all fully vaccinated travelers whose vaccinations can be securely verified will not have to quarantine. This includes Caymanians, residents, work permit holders, and others with close ties to the country, along with tourists. Secondly, travelers whose vaccinations cannot be securely verified, but who are traveling from a country with the first dose vaccination rate of at least 60% will also not have to quarantine. All visitors must be covered by a medical insurance policy which covers COVID-related expenses should they test positive during their vacation. I would like to emphasize that phase 4 allows for all vaccinated visitors to travel to Cayman and also includes children who are fully vaccinated. I see that there's been some articles and suggestions that children are excluded from the Cayman Islands, and it's not true. As long as they're vaccinated, they're allowed to come to our beautiful country. With that being said, some travelers will still be required to quarantine in phase 4. These include travelers whose vaccination information cannot be securely verified and who are traveling from a country with a vaccination rate below 60% for the first dose will be required to quarantine for 10 days. Unvaccinated adult travelers or persons traveling with unvaccinated children will still be subject to 14 days quarantine. With respect to pre-arrival PCR test, all travelers aged 5 and over will still need to provide a negative PCR result taken within 72 hours of travel, regardless of their vaccination status. Prior to travel, all inbound travelers to the Cayman Islands must apply to Travel Cayman for a travel certificate, which is required for entry. Vaccination information should be uploaded ahead of travel to the Travel Cayman portal for verification and for a travel certificate to be issued. The Chief Officer for Border Control, Mr. Wesley Howell, will be joining us via Zoom to provide us a brief outline of the travel certification process. He's in studio. I apologize. He was hiding in the corner. Mr. Wesley, thank you for coming. Afternoon.
Thank you. Actually, you're partially right. So I am in studio, and one of the brilliant technicians from Computer Services, who are partners in this, is joining via Zoom, and she will be walking through the demonstration. So we'll demonstrate, if we have 5 minutes.
Yes.
We'll demonstrate 2 versions of requesting the travel declaration. These are for persons whose vaccination certificates we can verify electronically, and those who can upload a copy of their paper document that we can then verify manually. So we'll go through both of those examples. So you would go to travelcayman.gov.ky. For those who have been on before, they will see that there's a new option on there for travel declarations. Your first time on the site, you'd have to create an account with an email address and password. That allows you to go back in and re-enter information. So we'll go through now and select one of the 2 options. And the first option on the screen is travel declaration. This is for persons who are fully vaccinated, and their vaccination certificates can be verified either electronically or manually. So we're going in. There's some legalese to read. We click on travel declaration at the top, asking for some basic identification information: name, first name, middle name, last name, date of birth. So we'll enter those details now. There's some information on that same page in relation to travel insurance. There's a project underway working feverishly to provide a locally developed and delivered COVID travel health insurance policy. In the meantime, we're encouraging travelers to have their own travel insurance, or to understand that any expenses that they may have in relation to a COVID incident on island would be on their tab. Going down there, another set of legalese, some consent. I'm clicking through for that. Then it's asking a question as to whether or not all of the travelers in a group are fully vaccinated. This is a requirement of the no quarantine period, in that all of the travelers in that party would have to be fully vaccinated to not have to quarantine. So click yes for that. And the next question is, are you traveling with a visitor or as a visitor yourself? Click yes for that. And the next question is whether or not they're securely verifiable. So click yes for that. We're now going through, so you can review the questions that you've done. So that's 3 questions that you've answered. You're now at a position where you click next, and you're presented with a box for which you can then click the common check. That's our partners. We're the first in the world to have this interface live and integrated and producing results on the fly. So we're quite proud of that achievement and thankful for Common Check for working with us on that. So now you have an option of using your phone, if you're on your phone, to take a picture of your QR code, or you can upload a file if you're working on a PC and you have, or Mac and you have that file handy. So we're just going to upload that file now. So select the file from the documents, click next, and we go off to their engine. So all our rules, all the rules that Minister Brian just explained are built into this check that's going on. So it's checking which vaccine you had, when you had your first dose, when you had your second dose, ensuring that you've had that second dose within 14 days of arrival in Cayman. And as quickly as that's done, and we get an approval on it, we go back to the dashboard, and we can then download the travel declaration. And here comes our travel declaration. So that's it. That's as straightforward as it is for a QR code. So about 3 minutes for that to be done.
Yeah, that was pretty quick.
So if we have a few minutes, I can run through the process for folks who have an HSA card. That please, if you can, use the HSA My HSA portal and get your QR code. It makes your life a whole lot easier, as you can see. But for those travelers who are coming in that have the CDC card, for example, coming from the US, then we can also have the manual verification for those that don't have the QR code. So we're going back in again now, and we're entering first name, last name, date of birth, while she's going through, the note that the information on the certificate, the travel declaration certificate, is actually pulled out of the QR code. So that's where the name, date of birth, all that information is being pulled from as well, in addition to the vaccination certificate details. Are you fully vaccinated? Yes. Are you a visitor? You know, either way we can go yes or no here. So we can go yes with this one. And yes. No, we're not able to upload a secure verification. So this one, we don't have a QR code. Now we will go through, and at this point, we have a interim solution in that when you click that link to produce your upload for your paper document, we have another application. So we have to re-enter some of the information. In a few days, this will go away, and we will replace it with a more seamless integration where you don't have to re-enter this information. But for now, you do. So you're entering some of the same information you had before, name, date of birth, and you're uploading your copy of your vaccination certificate that does not have the QR code. Complete the rest of the information on there. So she will go through and enter those details. So we're capturing a lot more information now because we can't read it automatically off those cards. So we're using some of the data entry here. And you submit. And that has now been submitted to the Travel Cayman team, who will work in the background manually looking at this, checking that you haven't submitted a fraudulent document, that we can verify it's the correct vaccines that are approved, that the vaccine timelines match what we expect them to. And at the end of this, within 24 hours, what we're aiming for, you will get a different type of travel declaration. This one good for 1 month. I don't think I mentioned the first declaration using the QR codes, that's good for 3 months. That declaration means that once you have that, all you need to do to travel to the Cayman Islands after that is have your PCR test ready for the airlines when you check in overseas on your way in. You arrive with that and a negative PCR, you are free to enjoy the Cayman Islands as you wish.
CEO Hubble, I remember you saying there was 2 different types of certificates. And for those that are concerned about the safety elements, one of the other certificates has a major red bar like what we see on the screen.
Yes.
Can you indicate the reason for that?
So the reason is that what we are verifying when we have to do it manually is a copy of a paper document. So we can't feel it and tell all the security features and whatnot. So we want to ensure when you get here, we'll give an extra little check at our CBC officers at the controls to ensure that you are presenting us with a legitimate document. We know that some people who don't want to be vaccinated are buying fake vaccination certificates and using those as a means of traveling. So we are looking out for those, and the penalties are quite steep for those who go down that route. But that's the reason why if you're not using that QR code, that we can pull that information and verify it electronically. The manual process does include the additional step of having a shorter period on your evaluation, and we would do our extra checks on arrival.
Thank you, Mr. Hubble.
Thank you, sir.
I think Mr. Hubble is going to stick around just in case there's any questions from the media. That being said, throughout each touch point into the travel process, the government's focus on safety remains a priority, as you heard from CEO Hubble. Safety of passengers and airport staff are key among those considerations. So while traveling through the airport, social distancing is applied as much as possible throughout the terminal. Masks are always required to be worn inside the terminal. Hand sanitization stations are placed at the entrance and exits throughout all terminals. Moving now to passenger pickup and drop-offs. As a reminder to travelers, in keeping with the new international safety regulations pertaining to the airport terminals, only licensed public transportation operators are permitted to do drop-offs or pickups of passengers on the curbside. All other vehicles are required to use the short-term parking lot for picking up and dropping off passengers. I know that this is a bit of a difficulty for some, but we're trying to resolve it, and I'll have more announcements in the future. 5-minute drop-off zone has been created in the parking lot for offloading of passengers and luggage. Drop-off is free for up to 5 minutes, after that time has passed, standard parking rates will apply. Ground transportation staff is available to provide customer support. Additionally, Customers are to call 936-PARK, and that is 936-7275 for parking lot assistance. Luggage carts are available in the short-term and long-term parking lots, and a golf cart is available to help passengers who may need assistance. Now moving on to the airline schedules, looking in anticipation of the borders reopening, interest in visiting the Cayman Islands has remained high, and we know that there's a lot of pent-up demand that will translate into booking, particularly in the first quarter of 2022 as airline capacities increase. In addition to twice weekly service from JFK, New York, JetBlue will relaunch service from Boston on the 20th of November and from Fort Lauderdale on the 21st of December. Air Canada is on schedule to be the first international carrier to resume service from Canada and will relaunch its Toronto service from December 4th, followed by WestJet on the 16th of December. Cayman Airways will also continue to resume service to JFK starting on December the 16th. New York is the number one U.S. gateway for the Cayman Islands and consequently plays an important role in our tourism recovery strategy. The easier it is for travelers to get here, the more likely they are to choose the Cayman Islands vacation over any other destination with less convenient travel options. I'm therefore very pleased that the New York market will be served by 3 different airlines. Shortly after the government announced its border reopening date, the Ministry of Tourism contacted all the airline partners requesting that they reconsider to give resuming service a closer look to the date of the 20th for reopening. I'm pleased to update that the country that all the international airlines that were flying to the Cayman Islands before the pandemic have now confirmed their intention to return between November and March of next year. Some of them not quick enough, but we'll take what we can get. This includes American Airlines, Delta, Southwest, and United, and all those I mentioned before. The resumption of these services will be hugely beneficial to stayover arrivals because it means that visitors will be able to connect to the Cayman Islands from over 21 gateways across the UK, US, Canada, Jamaica, Cuba, and Honduras. In closing, one of the most important aspects of our border reopening is that this opening should be about employment opportunities to put Caymanians back in their jobs. With reopening now imminent, I would like to remind the private sector that the government's policy is Caymanians first in respect to employment opportunities. I therefore encourage those in the industry to start focusing on giving Caymanians jobs. With several thousand Caymanians currently unemployed and being supported by the government, it would be unconscionable to consider granting of work permits while this situation remains. I urge our private sector partners in the tourism industry to look at Caymanians when filling their vacancies. Ladies and gentlemen, moving to phase 4 signifies the achievement of another milestone in the government's carefully considered step-by-step approach to safely reopening our borders. I hope you have found these updates useful, and to be clear, the plan that I have outlined is not just for visitors, it is for the Cayman Islands. And the Cayman Islands reopening plan applies to travelers, both residents and visitors alike. I would like to remind everyone that keeping our country safe and fostering a lifestyle of ongoing risk control measures are not just key to reopening of our borders, but it will be a part of our lives for the foreseeable future. Thank you.
Thank you, Minister Bryan, for that update. We now turn our attention to Health Minister, the Honorable Sabrina Turner.
Good afternoon, everybody. An honor to be here today as we move to the next stage of our border reopening process. Firstly, my condolences to the family and friends and loved ones of the 2 COVID positive individuals who recently passed away. And, may their soul rest in peace. And also, as we've learned the passing of a well-respected member of our medical fraternity here in the Cayman Islands, Dr. Edward Corderon. I personally had the pleasure of working with him back in the day, And my condolences as well to his family and friends and colleagues. We are so grateful for his contributions to healthcare in the Cayman Islands, and he was recently a member of our very own Health Insurance Commission. May his soul rest in peace. Now, phase 4 has been long awaited and by many, and I am mindful of the public's concerns with the increasing number of COVID-19 positive results that have been reported in the past few weeks. This afternoon, I would like to highlight a number of the initiatives and actions that are being taken on by our very own Health Services Authority, Public Health, and my ministry to ensure that the health and safety of all of the residents and visitors as we continue to increase our vigilance and the management of the pandemic. First of all, let me assure you that the Health Services Authority is making plans to expand the operating hours of the flu clinic. I would like to also take this opportunity to encourage our private sector partners to support the efforts with HSA colleagues in the treatment of patients. I would also like to inform the public this evening that additional isolation rooms have been stood up in Accident and Emergency Department. And this is to allow us to isolate and safely manage the care of persons who are confirmed to be COVID positive, whilst being able to render care and assistance to other patients. Now, let me do my best to address some of the apprehensions in the community as it regards to seeking care just because of the misunderstood fears of contracting the virus within the healthcare setting. I don't want anyone to be unwell and be fearful of going to our hospitals because it is looked at as a COVID place. Let me reassure you that the healthcare setting is one of the most safest place due to infection control measures that has to be put in place to protect our patients and our staff. And universal precautions are used to ensure the safety of everyone. For those persons who have pre-existing conditions, who are immunocompromised, or who are generally feeling unwell, please ensure that you maintained your scheduled appointments with your healthcare practitioner, because delaying your visits for your appointments could further compromise your health and lead to unfortunate outcomes of your conditions that could easily and possibly be treated if caught on time. The hospital is also converted a significant portion of their inpatient rooms to negative pressure for the safe management of COVID admissions. You may see along the outside exterior silver tubings coming out of windows along the main roads. These rooms are those rooms that are created into that negative pressure to safely manage and control those patients who are receiving treatment. I am also pleased to advise you that arrangements to set up this field hospital at the Family Life Center has now been initiated and will be operational in the next few weeks. Now, this facility will hold a capacity of 80 beds. However, it will be set up in phases so that initial beds will aim to be ready for mid-December. Many of you may saying, oh, well, I'm hearing that the hospital is overwhelmed. What's the sense of having beds when you do not have staff? I will cover that as well during this presentation to reassure and dispel of all of those fears and give a true better understanding of what overwhelmed means as it pertains to clinical care and overwhelm in not being able to handle capacity. Now, with this facility, the care of less severe COVID patients will free up the HSA so that it will allow them to continue to its elective work without interruptions. And more COVID patients will continue to be cared for, of course, at the hospital. HSA is also working to recruit individuals. This is to be able to staff the field hospital. And these individuals are being sourced both locally and overseas, because we do admit that we do have some persons from the legal field that are retired, that are here, that are willing and capable of lending their talents and help us during this crisis. So HSA has already recruited over 30 nurses who will be starting within the next 2 months, and with more job offers and interviews that are still ongoing. We have heard a lot, both all of my colleagues and myself, about the flu hotline. Let me reassure you, the flu hotline has been expanded with additional staff operating from a new location, and this is due to the increasing of our capacities to respond more efficiently to the growing volumes of calls, to reduce hold times for those who are calling, as well as improving the work environment for staff overall. With this designation, we will have all persons operating safely from one location so that we can gauge and manage even the response. With the additional demand in waiting times, some can be as long as five minutes, and we understand with the frustration, a minute can seem like an hour. I'm asking each of you to please bear with us as we strive to deal with each person and give everyone that individual personal care that we all deserve. We understand that many have requested isolation letters, and currently there is a backlog which is being addressed as expeditiously as possible. Within the next few days, Public Health will be launching a new isolation request release form, which will also help to expedite these requests. If you have a positive PCR result, the lab from the lab, this can serve as your isolation letter for an employer and or to request for the government ex gratia stipend. In this same regard, if you are a previous positive, once you test negative via PCR, this can also serve as a release letter. So I'm appealing to all of the business owners and HR specialists out here for this important fact, because we recognize that persons testing positive on LFT and unvaccinated household members of positive may still require letters, and these will be addressed through the form. We also recognize that there has been an increase in demand for vaccination records for persons wanting to travel. And we are adding administrative staff are being redeployed to input the vaccination data into the patient portal due to the increased vaccination rates. And I would like to take this opportunity to commend our community to responding so well to our appeals for vaccination. However, I am imploring you, as our own Chief Officer Howell has stated, to sign up to the patient portal. It makes that whole process much easier in being able to get off the rock, so to speak, and sign up online for that. Alternatively, persons can visit HSA at the atrium Monday through Friday from 8:30 until 5, where you can also get assistance in being able to sign up through the HSA portal. We have also automated the self-reporting of positive cases via the lateral flow testing. And to report positive results, persons must use the Public Health Secure form, and that is on www.explore.gov.ky. Now, let me take this moment to really pause, because this is so important that I put emphasis on this. Failure of anyone who is testing positive on a lateral flow and they fail to report it to Public Health, this is an offense under the Public Health Act. I know a lot of you are panicking in fear. You all are opening as of the 20th. Look at the high numbers of community spread. Some have this thing in their mind that if they test positive at home on these lateral flows, but they're feeling fine, I'm not going to report it to a soul. They're not going to know. We are smarter than that. We are more responsible than that. And if you want to help us, help our country to be able to manage and live and go on with our lives, do the responsible thing and report your status. And do that by reporting your positive by these lateral flows. We must all do our part to keep our community safe. And by doing so, you have to report once you're positive. Isolate and adhere to all of the public health advice and keys that will help us reduce the spread and definitely take care of our most vulnerable and those persons who cannot be vaccinated. Now, due to the increasing number of the community positives, public health will aim to make contact with you the day before your exit test. And for those individuals, just to make it clear, vaccinated persons will be tested on day 11, which means you're isolating for 10 days. So you're not going to get a call or visited on day 10, you're going to get it the day after. For unvaccinated individuals, you are isolating for 14 days, which means the day after that, day 15, you would be scheduled for the test. I've just stated we've seen an increased number in community spreads. So no, we do not have the manpower to public health to go to every household. As such, over the past few weeks, in us enhancing our services that we're providing from public health, we have opened 3 exit testing centers across Grand Cayman. And this is to provide a more convenient access for persons who are requiring these exit testings at the end of their isolation periods. These testing sites are open 7 days a week from 11 in the morning until 1 in the afternoon. They are the Ed Bush Sports Center Complex, the South Sound Community Center, and Bordentown Civic Center. And these for persons who don't have means of transportation, we're asking you to feel free to call the flu hotline to arrange for in-home testing. Please do not call a cab. Do not go out by the road and hitch a ride. We will help you because we still need to know your status. I would like to take this time to thank my ministry, HSA, Public Health, and indeed for all of the healthcare staff who are currently working on the front lines to care for patients, and especially the lab. Oh, the labs of our private sector and HSA. Mr. Smelly, I'm going to have a one-on-one just with you for that genomic sequencing, all of these data. And I know the demand is there, but I have to do that special shout out. But every one of you are very special to us, and we appreciate all of your work, from the nurses to the cleaners to the food service, you name it, admin people. We appreciate what you continue to do. Public health as well. has taken a strong lead in the areas of vaccination, testing, surveillance, and contact tracing. So my sincere thanks goes out to everyone who's involved, and we are extremely grateful. Thank you, thank you, thank you. To manage the crisis, staff has been spread across the islands to carry out these essential activities 24/7. And with the large rise in numbers of cases that has led to delays of reporting of these positives, to minimize these delays, we have turned and adjusted the process and procedure, and we are committed to learning from the experience and improving our service delivery in the days ahead. But we remain thankful for the majority of persons who are testing positive and are asymptomatic, are able to manage mild symptoms. We're asking them to please remain at home. Of course, our need for staff continues to grow proportionately, and 52 temporary positions have already been added to the COVID response within HSA and Public Health, with more recruiting that is still underway. Additional resources will be provided by governments. This includes the setup, again, as the field hospital, additional staff, and PCR testing that is being conducted through all 3 hospitals. Now, I know things have not always gone smoothly, but we are committed to our continued improvement, and we trust that our hard work that has gone into developing this plan for our healthcare sector will be reflected in our actions with your cooperation. We have seen in other contexts that around 2/3 of the hospitalized patients are unvaccinated. First and second dose remains available to all persons over 12 years of age. And if you're eligible to be vaccinated, please go and do so. Trust me, it works. For those who are already fully vaccinated, Public Health continue to roll out its booster program for persons age 40 and for healthcare providers, teachers, uniformed services, and those who are extremely vulnerable. This initiative was recently enhanced by the arrival of nearly 12,000 additional vaccine doses from the UK. Also, the implementation and the use of lateral flow tests has also proven to be of substantial benefit by affording persons to quick and easy means of knowing their COVID status to be able to get on with their lives. In particular, this also allows fully vaccinated people who are primary contacts of positives to move around as long as they continue testing negative. Of course, this approach relies strongly on the integrity of persons using the test. And we're depending on you to report if you're positive and do the right thing. To make this easy as possible, you know that government is committed to supporting those in isolation for whom creates hardships. My thanks to those persons of the public who have been isolating and testing responsibly, even when conditions are less than ideal, something that we are striving, definitely doing our best to remedy. Finally, in these complicated times, I would like to end by reminding you of an important resource of ensuring your own health and wellness, and that of those of you love. The mental health hotline operates Monday to Friday from 9 to 5, and it is available by calling 1-800-534-6463. And over the course of this crisis, many people have benefited by reaching out to the helpline. In the coming days, I will be sharing some more stats in regards to how we've been hoping, some tips and all of that sort of stuff, and just pay more attention on mental health. Let us all continue to do our part as we move into the next phase of the reopening plan. Please continue to wear your mask, practice good respiratory hygiene and social distancing for 6 feet. Black Friday is coming up. I know many people are going away. And guess what? They're our own Caymanians. They are coming back. You're coming back. I want you to do the right thing. Even though we're open, our borders, we're welcoming tourists, you have gotten the freedom to go away and return without isolation. Please keep conscious that you are going to another country, exposing yourself much more, coming back. Be cautious when you're going to your grandparents, to the older shut-ins. Just do the right thing. Wear your mask, practice good hand sanitation techniques, and just be responsible for the first couple of days when you come home. Buy those lateral flows, test yourself, avoid the older people's home, avoid all of those persons that you know who are immunocompromised. Freedom is good, but let's be responsible in the management thereof. Thank you, and God bless.
Thank you to Minister Turner for that update. We now transition to our questions from media with the limitation of 4 questions. And we begin now with Caymanian Times, Lindsay Turnbull.
Hi, thanks very much. Just a question to Minister Bryan. With regards to the cost of the 3 LFTs that travellers are going to have to pay for, you said they were $25. Is that for all 3 or each?
Each. And let me just put some context in respect to the test. The providers have to do a lot of administrative work on the back end, which is a costly exercise outside of paying for the test themselves. I hope that the price can be renegotiated down in the future when we know the prices of the tests, when they're more available, will go down. But when a person gets tested, they will be responsible for emailing that individual and letting them know what the results are, whether they're positive or negative, and also be obligated to report back to public health if there is a positive. So there's back end work. It's not only just the testing itself. Trust me, I'm trying to make it as cheap as possible because we don't want to make a headache for our visitors.
Okay, thank you. Second question, just generally, are you going to make LFTs a little bit more accessible for people?
Well, we're definitely working on that now. And I know there's a lot of private sector individuals out there who are working really, really hard. Everybody wants them now, so there's a bit of a bum rush, but I don't think it should be too much of a problem in the next couple of days. I even know that there's a large supply coming through private sector this weekend. I think the British flight comes in tomorrow or today, I can't remember. But hopefully by this time next week, there shouldn't be any more complaints about lateral flows, at least for the foreseeable future. Okay,
thank you. Dr. Lee said that he didn't have any more information on vaccines for children under 12 in Cayman, but I'm hearing that there are parents that are thinking about going to the States to get their children vaccinated. What's your sort of thoughts on that, just generally to the panel?
Well, personally, I'm fine if a parent decides to do so. Once the United States takes that policy position, we would recognize it, I assume. I don't think that there's no indication to not accept their position. Now, obviously, this comes up as a result of that, we follow the UK's position, but that doesn't mean we would not respect the vaccination status of children between 5 and 12 as for the United States.
Okay, thank you. And the last question, just to the Premier. Premier, you said that if behaviour is uncontrolled, you may have to implement additional control measures. I wondered if you could just expand a little bit on that.
Well, I mean, I think we would have to look at the scenario to see exactly what's happening. We'd have to get the advice from the medical professionals as to what sort of actions would specifically address what is being observed. But obviously, it ranges from tightening up on mask wearing requirements, tightening up on social distancing, doing more enforcing, lowering gathering limits, limiting the numbers of people who can attend certain events, and that goes all the way down to the ultimate sort of nuclear option of a lockdown scenario, which we do not want to be talking about. And we certainly want to avoid at all costs. And I think one of the driving factors for us in trying to get to maximize the level of vaccination as much as possible in this country was to make sure, as far as possible, that we avoided that sort of risk and avoided the possibility of a lockdown. And I do think that we're in a good, strong position to do so. So I believe that with appealing to people, with getting the cooperation from the community, to adhering to the current standards, and even necessarily, if necessary, tightening some of those standards, I believe we can avoid the worst case scenarios.
Thanks very much.
Thank you to Caymanian Times' Lindsay Turnbull. We now turn our attention to Radio Cayman, April Cummings.
Hi, Shanda. Thank you very much. I hope you can hear me okay.
Yes, we can.
So just a couple of quick questions. The first is, I think for Minister Turner, but it may be for the Chief Medical Officer. Just as from a listener who wanted to know about what the status is in terms of indoor sports. Is this something that we are still discouraging or banning, or is it something that we have revisited yet?
I'll invite Dr. Lee.
Hi, April. I've consistently said that indoor sports are not something that are advised. You don't want people, certainly you shouldn't be wearing masks when you're undertaking any sports activities. You'll also have higher heart rates, you'll be breathing faster and harder. And for that reason, it's an increased risk of transmission in that scenario.
As a companion to that, one of the questions that parents have asked is about things like, I say pee-wee football, but, it could be soccer too. Just, games, sports events like that outside. Are we comfortable with those? I know a lot of those are on hold right now, but in terms of medically, are we comfortable with kids playing, traditional sports outdoors?
Generally, anything that's outdoors is far, far more preferable than things indoors. I think you've always got to balance matters. You really want kids to take exercise. It's such a strong benefit, not only for themselves, for their psyche, but also for their futures, for their health. It always has to be done with balance. If you can do sports that maintain more distancing, that's a very good thing. But you have to always temper that with, as I've said, the benefits to the individual person and their long-term future as well.
Thank you very much. My other question is for the tourism minister, and you may have answered some of this while I was running back and forth between the studio and here, so please forgive me. Do we have a sense of how many people are coming? And as a companion to that, how comfortable are you with our state of readiness?
I heard the first part of the question. Can you repeat the second part of the question?
The second is really, how comfortable are you with our state of readiness?
I am perfectly happy with where we're at. To be honest with you, because the first part of my question I'm not happy about, which is, so far I just got the update from CEO Howell earlier today about the amount of approvals we have. And we only have 4,108. So there's not a very large amount of people, which is what I expected to be a slow growth of travel. And that's spread over a number of days. We have a lot of outgoing. We'll probably see a lot of people returning back in another week and a half, and people start to uptake. So, and the Minister for Health and Wellness has provided the team the preparations that are necessary. And from my colleagues' perspective, I think I can speak on their behalf. They were all happy with what has been presented so far, and we feel ready and prepared. So the numbers are not going to be overwhelmed. What is here now, and we're seeming to, like Dr. Lee said, as long as it stays steady the way it is and not go any further, we seem to be having things reasonably under control.
And do we have any number cap that says this is how many people were comfortable coming into the country?
The discussions we had in respect to our modeling were for 20,000 persons, more than the population. So, and so far we're not even close to that per month. So we're well within the range of what our hopes and plans of preparation were for. So to have enough PPE, to have the hospital, the emergency hospital up and going, and all the medical preparedness we need. So we're well within that limit.
Thank you very much. I think that's my allotment of questions for the day.
That is. Thank you, April Cummings from Radio Cayman. We now turn to Wendy Ledger from Cayman News Service. Wendy, are you there? Wendy? Going once? Going?
Yeah, I'm here. Sorry, I have too many windows open. I couldn't find the unmute button.
All right, you're good.
Don't worry, the questions are going to be really quick. When will vaccine mandates for frontline non-Caymanian civil service workers be rolled out?
Deputy Governor, Acting DG.
Wendy, we're going to call on Acting Deputy Governor, Ms. Gloria McField-Nixon, to answer that question.
Thank you. And Wendy, thank you so much for that question. I can say that we are actively reviewing policies that would be necessary to give effect to a vaccine mandate for non-Caymanian civil servants that would be aligned to the national policy that's already been adopted for work permit holders within the private sector. That is a matter that we are actively reviewing. But otherwise, the emphasis continues to be for continuing public education for our civil service, including our frontline employees, as well as continued priority access to vaccines, as well as bespoke vaccine clinics. I'm happy to say that alongside what we see happening in the general population, our vaccine levels within the civil service are high and continue to climb as persons take advantage both of vaccine availability as well as booster availability. So we are happy on that front that we are seeing high numbers and increasing rates of vaccination across our public service, including on the front lines. The policy consideration right now is looking at whether we would be matching the mandate that already exists for work permit holders within the private sector. And so we're looking at what the policy considerations would be for that in doing that in the civil service.
Okay, thank you very much. Second question. Why did government renege on the test purchase order with Blue Water, given the cost of those tests appears to be a lot lower, and instead we're using Crown agents in what appears to be an absence of a proper procurement exercise?
So Wendy, you've just gone into a set of facts that you have or seem to be privy to in terms of your perspective on the issue. What I can say is that this is a matter now that is appears to be heading towards possible litigation, and as such, it's a matter that our Attorney General's Chambers is dealing with. It wouldn't be appropriate for me to comment on that or any of the assumptions that you've set out in the question.
Okay. Next, sorry, I'm going so fast, but I know we're limited, so I'm going through them as quickly as I can. This one is, in a household where both parents are vaccinated, but children are not, and one person tests positive, why are other negative unvaxxed children allowed to go to school when the same does not apply to families where a parent is not vaccinated?
Thank you, Wendy. I don't think that question's for me, so I'm going to allow Dr. Lee to take that.
Williams, Rodriguez.
Thank you.
Sorry, Gloria, it's not. No, that's for Dr. Lee.
Thank
you. I didn't want to say this is for someone else in case that was counted as a question, which is what happened to me last time.
Hi, Wendy. I've looked at the question a few times and I'm not sure if I fully understand it. I get a little bit confused as well. But I think the answer is as follows. Children can't be vaccinated, and we're also certainly not forcing children to be vaccinated in any way. And their education is of paramount importance. And for that reason, we wish children to continue to go to school, to continue to take their education, because that is something that is exceptionally important in any child's life and in their development. They will be party to the lateral flow policy, which keeps an eye to see if there's any infections developing. And that is what we're doing for that category of citizen.
Okay, I have a follow-up, but I'm worried about it being counted. So my fourth question is, given we have nearly 5,000 people in quarantine, what more can be done to ease the pressure on the business community to have so many workers out of commission?
Not really a question I can help with.
Wendy, who would you like to direct that question to?
I would imagine that's either the Premier or the Health Minister.
Wendy, can you repeat your question, please?
Yeah, sure. With 5,000 people almost in quarantine at the moment, what can be done to ease that pressure, which is impacting the business community, particularly because a lot of these people are workers, obviously?
Well, in relation to the individuals who are positive, obviously they have to remain in isolation. So the question then becomes, what happens to those individuals who are of the same household and who are contacts of that individual? And the national lateral flow test policy is clearly something which is designed to assist in that respect, to enable people who are vaccinated to test and to be able to go back to work as long as they test every day and they are negative. In relation to the question of positives, obviously that's a function of us trying to ensure that people maintain the degree of adherence to the public health protocols, to try to bring down the level of infection, bring down the level of positives.
Hope that answers the question.
Thank you.
Okay.
Thank you, Wendy. That's Wendy Ledger from Cayman News Service. And we now turn to Cayman Compass, Angel Harris.
Thank you, Shanda. And I too will begrudgingly keep within my 4-minute questions.
I think you should get 5 because you came in the studio.
Oh, thank you. I agree. All right. We just heard that. 5, an extra one, bonus. To begin with, either to the Premier or to Dr. Lee, we recently saw our first 2 COVID-related deaths in almost a year. With the borders set to reopen on this coming Saturday, what are the numbers as far as potential deaths? How many has government projected in line with the borders being reopened?
Well, firstly, I'd like to join with Minister Turner in extending sincere condolences to the families of those individuals who have passed away, who lost their lives, being COVID positive. I have spoken to the families, most of the individuals anyway, and expressed the same. The projections, the modeling that we have done in relation to, what impact we would have from different levels of tourists coming in, don't really change significantly as long as we stay, I think, around the 20,000 per month mark. So there has been there's a slight uptick that's sort of predicted in terms of the models, in terms of possible increases in hospitalization, but there's very little change in terms of the possibility of people passing away. Obviously, we want to, and we're keeping our fingers crossed, we want to minimize the risk at all costs of losing any more people. But this is a reality that we do have to face. We do have a considerable level of community spread, and even with our very high level of vaccination, we do run the risk of people getting sick, ending up in hospital. So we need to bring that down. There is, even though the correlation between the level of positives and those in hospital and those who may be at risk is a lot lower with a high vaccination population, there is still a correlation, and if that number goes up, then the risk goes up. So we want to reduce that risk, and we think that given what we expect in terms of the growth, the relatively slow growth of our tourism numbers, the risk isn't going to increase significantly.
Can I add to that response, please? The behaviors and actions of our very own people in comparison to those guests who are returning to our shores and tourists more outweighs the exposing of our vulnerable and our elderly. The tourists that are visiting our shores versus our very own people that are traveling overseas to get off the rock, to shop, to get on the deals, pose a more greater risk than the tourists that are coming to our shores. Those tourists are not going to be the ones going to granny and auntie who's bedridden.
Church.
They are not the ones that are going from one watering hole to the next, and then somewhat, hey, I went away. It's so good to get off. Here's your package. Look at this deal that I got. Look at these shoes. I fly. They don't even realize what they're doing. And this is why we cannot hammer it home enough. Wear your mask. Practice good sanitation techniques with your hand. Avoid from visiting auntie. Worse if you know that person, that family member, giving them an early Christmas gift is a dialysis patient, is a cancer patient, is someone who may be in remission. Your trip going away and delaying the delivery of that parcel by 5 days is day and night with saving that person's life. Unless you adhere and do your part, I can assure you the risk is raised with our very own people that are going to go away and come back. And I stand to be corrected and reconfirmed by the experts in the room. But I can assure you, Mr. Harris, we as Caymanians going away and coming back are the ones who I am expecting to conduct themselves even more so in a better behavior than those persons who have this pent-up demand of coming to be on our beaches, go diving, in the night they go get a little food, and they're going back to their hotel rooms. I'm appealing to my people, to conduct yourself as though we were still in isolation, even though we have agreed to give you the freedom of non-isolation.
Premier Panton.
Yes, sir.
We received reports from various government departments, agencies that seem to be adopting a similar policy, which is that for the unvaccinated people who are required to isolate, they will have to take vacation days or unpaid leave to satisfy this government requirement. What happened to the fund that is available? Why are they allowed, or will they be given access to this fund? And if not, why?
I think what I have indicated in the past in relation to that question is that we do have an ex gratia payment which is available to help in scenarios where people end up in isolation and are unable to work and need the assistance. That program exists. I think the last time you asked the question, I apologize. I was going to get back to you to give you an amount. As far as I recall, it is, and perhaps any of my colleagues can correct me, but I think it is in the region of $1 million, which has been set aside for those purposes. And that is an ongoing process. I am aware of some people who have applied and who have had assistance in respect of that. But understand that this is a public health issue. This is not just a discretionary issue. This is not just a policy for the government to require people to isolate because they're positive. It's a public health need. But we recognize the impact that it has on particularly certain families who work on an hourly basis, who don't have the ability to work from home. We recognize that. And that is why we put in place this facility and mechanism to help support families in that situation.
Thank you. 2 questions down. As sticking or staying with you, Premier Panton, we've seen in the courts where several of the quarantine breach cases are simply being thrown out, the ones that actually make it to court. And on the day of court, the prosecution ends up offering no evidence because it cannot meet the evidential threshold. Simply shifting the burden now to the people by making it a ticketable offense, how will this stop the problem? Won't they just go to court again and beat the charge by being able to provide the same evidence that they're providing right now, which is thwarting the prosecution's case?
So your question is breach of quarantine is a ticketable offense?
Well, the the new regulations that you are earlier in the press conference, you said that the new regulations will see the matters become
Right.
ticketable offenses.
Not everything.
Okay.
And I think, I stand to be corrected, but I do not think that it relates to breach of quarantine. That is still an offense,
Exactly.
which is subject to summary prosecution. And if you're convicted, you can get fined up to $10,000
Or
and
imprisoned.
have a custodial sentence of up to 2 years.
And I stand corrected. Yes, in fact, you did say there are 18 things that would be considered as ticketable offenses, but we weren't
Right.
exactly told what.
I didn't specify what they were. So we went through a lot of the different things that, you know, that were offenses under the law, but we didn't think it was necessary or convenient to have to prosecute people for all these different offenses. So we made them ticketable offenses, as had been done in the past with breaches of certain regulations. I think that was done last year. So we brought back the concept of ticketable offenses into these new regs. But there are certain things that we have not made just ticketable. We don't want to put a fine on for something as serious as breaching quarantine. So that's going to be subject to prosecution. Going back to your point about the success rate, obviously that's not something that we can control. The police investigate it. They try to get sufficient evidence in order to be able to prosecute it, and sometimes they're unsuccessful. And that's just what happens. That's the system. There's due process, and there's a standard of proof that's required, and sometimes they don't make it.
Thank you. Mr. Brown, you did suggest that I be allowed one more, so two more to
I
go.
hope that doesn't get me in trouble now.
You're using up your one Christmas present.
I'm going to take it. Mr. Bryan.
Yes, sir.
Starting with there are several people who've expressed concern that they might be, when they get off the rock, they might find themselves testing positive before they're able to come back home to Cayman, and or students abroad who are wrapping up school and wanting to come home and might test positive within that 72-hour window. And they're asking whether or not government will consider allowing Caymanians and permanent residents who test positive to still be able to come back home and quarantine or isolate at home. Is this a possibility? Will the government consider this?
Well, I think that there's a lot more people qualified to answer that than the Minister of Tourism, even though it has to do with travel. I was just about to say, most commercial flights wouldn't even allow you on the plane. And as per our regulations now, the law says you have to have a negative PCR test to travel to the Cayman Islands. So it's against the law. I recognize your concern, though, that you have Caymanians abroad who are positive with the virus. Now, that could be in different circumstances. Persons who are living abroad, they have family and support systems there. I'm confident, though, that with the Deputy Governor's office, if a Caymanian finds himself in trouble and reaches out to the government, we'll do everything within our power to assist to make sure that they are okay. If they need access to care, we'll get it there, or monies to cover them while they're abroad in difficulties. I'm assuming no finances are available to help themselves. And we've had such circumstances like that before where the Deputy Governor's office have stepped in to assist. Now, we don't have NS pot money, but we're not going to leave our people abandoned overseas, and we'll assess it by each case. So, but the preference is for you to overcome the circumstances where you're at with care and attention and get you back home as soon as you're negative.
And thank you for my fifth question before Ms. Gallego steals the mic. And appropriately, that fifth question is, what's the update on the grand raffle?
Actually, I'm supposed to be doing an announcement with the group on Saturday, I think. I'm not certain. But I was invited to come and do the announcement at the DMS building. And if you just wait half an hour after the press briefing, I'll give you the announcement and you can put it in the headlines for Compass. All right. Thanks a lot, my brother.
Thank you, Mr. Harris from Cayman Compass. I know that time is well spent. Thank you for your patience. I'm just going to squeeze this last question. I think it's for Dr. Lee. It's from a member of the public regarding COVID vaccine for teens. A person on Facebook wants to know why in the UK teens aged 12 to 15 are having to take one dose of the vaccine, but teens here on island do both, or they're required to have both doses of the Pfizer vaccine.
Thanks for the question. I think really in the UK, they're taking a more cautious approach with rolling out the vaccines for children. You may be aware, or your inquirer is probably aware, that they've recently allowed 16 and 17-year-olds to take the vaccine. And I'm pretty sure that they're then going to push this down for the 12 to 16s as well. Many other countries of the world are very happy to consider people fully vaccinated between the ages of 12 and 18 should they have 2 doses. That is the case in Cayman, it is the case in the US, it is the case in Canada, in the EU, and many other countries in the world. It's simply a question of their public health agencies have taken a slightly different stance, but I suspect that with time they will move on that, that may even be before the end of the year.
Thank you. Thank you, Dr. Lee. I believe those are all the questions from the media representatives, and we'd just like to thank you for your questions, and I will turn it to final comments from our ministers.
Well, let me give my colleagues the opportunity first.
Premier, I hope you mind. Thank you so much, because I do have something more on a positive note. As you all know, we are a seafarers society, and like the Premier said, the good ship Cayman and being seaworthy as we lead the country forward. What a great time to announce the fact that the Cayman Islands Seafarers Association annual Christmas raffle. And I expect you guys out there, because the Seafarers Association is so important to our history and foundation, who we are, to go and buy a ticket. You can go to their office, which is at the top of Victory Drive at Prospect, or most of you know Mr. Denniston Tibbetts, which is the former leader of government business, Mr. Kirk Tibbetts' brother, to ask him for how you can get the tickets. His number is 916-3334, 916-3334. He's the president of the association, and he would appreciate, on behalf of all of those seamen, to buy a ticket for the raffle, which is on December the 4th, just around the corner. So help us, help them, and pay tribute to the country. 916-3334 for the Seamen's Association annual Christmas raffle. That's me. Thank you, Brian.
Thank you for the opportunity, Minister Bryan. I think you need to check your phone about that raffle, but I'll get my little two cents in, so check your phone.
Okay.
I'd like to thank everybody for their continuous cooperation with the public health guidelines. And this evening, the vaccination clinic is ongoing at 33 Marina Drive. Public health is there until 7 p.m. tonight. I've been shared a picture from those persons who are already at the constituency office. And I must say there has been an overwhelming show of persons who are lined up for their vaccine. So we continue to encourage that. We have seen the positive effects of persons who are vaccinated and how they deal should they become infected. Again, I want to wish everybody a beautiful and safe evening. And, we're going to do this, but we got to do it together. And please remain responsible. Over to you, Premier.
Sorry to stop you. I just do have the answer for Mr. Andrew, and I think everybody would want to hear it nationally. The announcement for the $100,000 winner will be on Monday morning at 10 a.m. and it will be broadcast live right here in the studio with the DMS crew. Sorry for the delay information, but Monday we'll have an announcer winner. Thank you.
Good, thank you. Gentlemen, thank you very much. There was a question earlier in relation to sporting activity indoors. I don't remember who posed the question. It may have
That
been
may have been from April Cummings from Radio
Yes.
Cayman.
And I just wanted to clarify a bit further in respect of that. The comments and advice provided by Dr. Lee was absolutely correct. And perhaps I'm not recalling the nuances of her question, but I think she was asking whether sports could be done on an indoor basis. And Regulation 16, I just wanted to clarify that Regulation 16 of the 2B, and to be specific, of the control and management of COVID-19 number 2 regulations provides that a sporting activity can occur indoors if people are vaccinated, or if they provide a PCR test, a negative PCR test, or effectively a negative lateral flow test, and they can maintain social distancing, and they otherwise comply with any guidelines issued by the medical officer of health. Now, effectively, that probably limits significantly the types of sports that can be played indoors, and that is a reflection of the concern, and for all the reasons that Dr. Lee has outlined. But I just wanted to clarify that it doesn't eliminate the possibility altogether. So with that, I want to thank my colleagues for having joined me this afternoon. I want to thank everyone who has attended, the media, everyone who has been watching. I want to join with my colleagues in again asking people to ensure that they adhere to the public health protocols, the safety standards. Everybody's familiar with them. We don't have to go through them again. I want to also join with Minister Turner in asking people to, as I said, in sort of a summary way in my remarks, but she certainly has gone into more detail, asking people to just be very careful when we travel and go overseas and come back. The reality is we do present a greater risk to our own community, and that has been the experience of others in our fellow overseas territories. The medical officers there will say that has been their experience. So I certainly want to encourage people to be very careful and be very mindful of that. I want to say that I'm very proud of the work that has been done by the civil service, my colleagues, and the wider public service, and the members of the private sector who have engaged with us and who have assisted us. The work of the program board has been amazing. They have had to put in so much overtime. Let's say we probably could never pay them and thank them enough. And this broadly relates to many others as well. So thank you to all of those people, whether you're public sector, private, civil service, core, or the private sector who have participated. And I also want to say that we are looking forward to welcoming our first tourist in the new no quarantine regime on Saturday. And this is something that I think we're in a position to manage. I think we're in a good spot. So let's be prepared to welcome those people, those tourists who are coming here. This is the start of a path for us going forward that I think is going to be one that we will be able to manage successfully with the help of everyone. That includes all of us in Cayman acting responsibly as well. So thank you all very much for listening, tuning in, and I want to wish you all a wonderful evening, and I'll extend that into tomorrow and the weekend as well. I'm told by my colleague that the lateral flow test kits that were expected to arrive on BA have arrived as well.
Thank you, Jesus.
So we have had issues with supplies in relation to lateral flow tests, but I think that issue is being resolved now. So moving forward, we anticipate that those issues should go away. Thank you all very much. Really appreciate it. Have a wonderful evening.
Thank you, Premier Panton, Minister Bryan, Minister Turner, our government officials, our journalists, and to you, our viewing and listening audiences. Thank you so much for tuning in. Just a quick reminder, you can watch today's press briefing in its entirety right here on CIGTV YouTube channel, as well as on Radio Cayman right after the 6 p.m. evening news. Until next time, I'm Shanda Gallego. Take care and God bless.
Purell hand sanitizer products are available at reliable supplies. Contact us today for Purell hand wipes that are convenient to carry with you, or alcohol-based hand sanitizer pump ideal for offices, schools, and homes. Contact Reliable Supplies today to get your COVID-19 supply at 949-9303 or stop by our showroom centrally located off Compass Drive.
Census 2021. Hey man, get ready. Census starting 10th of October 2021. Census West Bay, you ready? Census East End, we coming. Census everyone will be counted. Census 2021. Census but in town, are you ready? Census Georgetown, we coming. Census your info will be secret. Northside, get ready. Census Brackers will be counted. Census Little Cayman, we coming. Census people get ready. Census 2021. Census todos se cuentan. Census Latinos serán contados. Filipinos Makanda. 2021. Census Papa, are you ready? Census Mama will be counted. Census children and toddlers. Census 2021. Census information is secret. Census 2021. Census starting October 10th. 2021. Census 2021 census, census, census. 2021 census. Everyone counts.
Reopening is really exciting for everyone. I mean, it's a chance for us to get back to normal life, for us all to travel just as to welcome the guests. And I am really looking forward to that time. I think it's showing that Cayman is moving forward, and I'm one of those that's really excited about it. As far as the incoming tourists are concerned and possible infection rates, we have to remember that everybody that's coming in as a tourist, we're requiring in phase 4 to be fully vaccinated. So that's giving us a good deal of protection from any incoming infections. Additionally, we have put in place some particular requirements in that only those who are coming from a country with a high vaccination rate, over 60%, will be eligible for the no quarantine period, or if they've been securely verified, that the number of countries that have secure verification is not as great that's not very prevalent amongst our neighbours. The other additional factor, or two factors rather, are firstly, many of the tourists that come don't actually stay very long. So the average length of stay here is about 5 days. So we can imagine that somebody coming for a long weekend will have had their PCR test before they boarded the plane, and then they'll be going back home actually really relatively quickly. And that needs to be taken into account when we're considering the impact of people coming to the island who might be bringing infections. The other thing is that unlike some of our countries, we've actually put a lot of controls and protections around the non-pharmaceutical measures that we have. So we'll continue to be asking people to wear masks, to distance, and to practice hand hygiene. And we all have been very good at doing this sort of thing within the Cayman Islands, and we are going to be encouraging our guests and our visitors to do the same.